Today's instructor video will focus on the processes by which we define and understand mental illness and mental disorders, and specifically how we come to know about mental illness or mental disorders through the processes of assessment and diagnosis. So first of all, here is just a little joke if you want to pause your screen and read this kind of funny little thing here about how to define what mental illness is. And the purpose of this joke on this slide here is to highlight how, to some degree, what we consider to be normal behavior and abnormal behavior is culturally defined. It is historically located. Something that is appropriate in our era may not be appropriate in future eras, and certainly might not have been appropriate in historical eras. When we think about what mental illness and what mental health are, those are two distinct concepts. Everyone has mental health. Everyone needs to address and manage and take care of and promote their mental health so that they have good mental health. Within mental health, there is also mental illness, where mental health is not functioning well. The two wordles in your screen below, the black and white wordles there, are the results of an experiment that past classes conducted, where they went out into the public and they surveyed people and asked local people of the community, not trained professional counselors, to define what mental health and what mental illness are. So the black screen, or the black box that you see on the left of your screen, is what people thought of when they thought about defining mental health, and the black font against a white background on the right is what people thought of when they defined mental illness. And what you see is that actually in the public there is some confusion about the differences between mental health and mental illness, but a lot of words about the mind and emotions, specific disorders, the idea of being stable or unstable. You can see the largest words represented in each wordle are the most common themes that came up during this experiment, and so the biggest words are the words that were most frequently cited. The DSM-5 definition of a mental disorder is listed here. The DSM-5 is the book that counselors, psychologists, psychiatrists, social workers, physicians will refer to when trying to make a mental health, mental illness diagnosis. And so that book relies on another classification system, the ICD-10, which includes all physical and mental illness, all diseases, whether they relate to the mind or the rest of the body. But you can pause your screen here and really get a thorough definition of what the DSM-5 considers to be a mental disorder. And you'll note, again, just as with the joke slide, that there is some reference to needing to make a culturally appropriate definition of a mental disorder. As we go through this slide and as you learn more about mental illness, you will see a couple of acronyms that pop up over and over again: SED, SPMI, SMI, and SPD. So I've just listed what those acronyms stand for here on this slide to help guide you through any reading that you might be doing, professional literature that you pull up where you see references to those disorders or those acronyms. So all human emotion is on a continuum, and we want to talk about human emotion when we're defining mental health and mental illness, because how we express our emotions influences our behaviors, and we want to make sure that we are understanding where certain expressions of emotion fall outside of the normal range or the typical range. But when we talk about normal, we want to understand, what do we mean by normal? And a lot of times people mean different things when they use that word normal. So sometimes people refer to normal as being, well, a person's mental health is normal if they don't have any symptoms at all. Or, well, but we know that most people tend to have some kinds of symptoms related to stress, transitions, crises that pop up in their life that are symptoms associated with mental illness. Someone may not have a full-blown mental illness, but they might have some of the symptoms associated with one. So sometimes people mean normal as asymptomatic, in that a person has no symptoms at all. Other times people refer to normal mental health as being what is typical or average. And so in that case, it would be typical or average to have stress. But typical or average is very population specific. So what might be typical or average for someone returning from combat as a soldier uh, might not also fit the definition of what we would consider to be normal mental health, even though their range of emotions and their experiences are typical for their population, but there certainly might not be what we would consider to be normal for the broader population. Sometimes people also use the word normal to refer to what is ideal. How would we like to be? What is our ideal mental health state? And then finally, there's the idea of normal processes. And this is a definition that I actually find there to be a lot of use in. The asymptomatic, typical or average or ideal all have a little bit of a problem in using those specific to mental health and mental illness. But when we talk about normal processes, we're referring to the ways that individuals move through life stages successfully using a variety of coping skills and effective problem-solving strategies. Now that is a definition that I think is very relevant to mental health and mental illness, because everyone has some type of challenge or struggle or transition in their life. And the healthiest individuals among us are going to be flexible in coping with the different struggles and transitions that we face. But not everybody uh, encounters the same level of stress, strain, or trauma. There are some people among us who have more stress, more strain, and more trauma. So it would be unfair to assess everyone by the same yardstick. But nevertheless, we do have to have some kind of organized classification system for considering what is a mental illness, what is a mental disorder, and what is expected, typical, average way of a person reacting to a situation or experiencing emotions and expressing them through behavior. There are various reasons listed for different causes of mental illness, and I have excerpted a blog post here that is a discussion between the Dalai Lama and a physician who is a renowned psychiatrist. And the psychiatrist is talking about how genetics and the brain are contributing to mental illness, but that they have to be kind of triggered by some external element, some kind of part of the lived human experience will have to trip those wires in the brain or with our DNA to activate something that might be lying dormant in any particular person. And so the Dalai Lama is, if you read through this, is saying that some all he's referring to depression in this case, but all mental illness is somehow connected or caused by a particular human experience, which would be that tripped, what is tripping that wire. So I invite you to pause the screen here, read through this, and see what you think for yourself. When talking about mental health and mental illness and mental disorders, you will sometimes hear references to the etiology of a particular illness, and that is the definition of etiology, the cause, set of causes, or manner of causation of a disease or condition. And sometimes in different treatment facilities, the etiology of a mental disorder will actually be an item that you'll need to fill in on your intake paperwork or your progress notes. So I want you to think about how we have these different beliefs about what causes mental disorder, and science is trying to really pin down specific causes, but the brain is so complex. We have so much more to learn about the brain, and then we have so much more to learn about the impact of human experience and how the brain processes different experiences in different ways among different people. So in the past, people believed that mental illness was the cause of some kind of moral weakness in character, or that someone was being punished for being bad, and so a mental illness was brought onto them in that way, or maybe there was something magical happening. Now, what we tend to be focusing on are going to be some kind of combination of environmental factors, especially exposure to stress and trauma, brain-based disorders, and how genetics plays it has an impact on brain activity. So the DSM-5 in its most updated edition really starts to focus more on brain science and incorporate more attention to genetic linkages among different disorders, and how neuroscience can help inform us of how to understand mental illness better. So we know that genes account for about 17 to 28% of the risk for mental illness, and the strongest links for a genetic component would be with diseases like schizophrenia, bipolar disorder, and ADHD. However, we also know that depression, anxiety, addiction all have a genetic component as well. One of the things that is an improvement in understanding mental illness has been that in recent years, the Mental Health America organization has done a lot of work in spreading public information that mental illness unfolds in stages. And a lot of times we think primarily about stage 4, where symptoms are very persistent, severe, and are jeopardizing a person's life. This is where the symptoms get a lot of attention, and certainly when you see references to mental illness in movies and popular culture, you're usually seeing references to this. But as practitioners and professionals in mental health counseling, what you need to be aware of are the ability to interact, engage, assess, and screen for these more milder symptoms and the warning signs that a person might have, so that we can build resiliency early on, and hopefully somebody won't then progress down into stages 2, 3, and 4, certainly not stage 4. If we can intervene in stage 1, 2, or 3, we have a much higher rate of success than by getting to stage 4. So what we want to try to do is to intervene much earlier. One of the things that your book did a great job of talking about was how assessment leads to diagnosis. So assessment is the formal process by which we try to understand a specific mental disorder or several disorders in a given client. So we have our client, and we need to do a lot of information seeking so that we have an idea of the symptoms, the behaviors, the cognitive functions, different personality traits, physical signs, syndrome combinations, maybe there's a couple of things going on, and the duration of all of these things. How long has the client experienced these? And then how long do each of the symptoms last? So has a person been crying 4 times a day for 3 hours at a time over the course of 7 years? Or has a person started having episodes of tearfulness that last about 15 minutes once a day, and it's only been about a month? So your clinical training helps you to differentiate between normal life variation and responses to stress and something that is progressing along that continuum of stages 1, 2, 3, or 4 towards a more serious mental illness. But assessment gives you the tools that you need to be able to ask really good questions, either through a formal instrument like a pencil and paper or computer-based inventory, or through a very thorough clinical interview. And once you have all of that information, you can start to formulate a diagnosis using the DSM-5. A lot of students have some concerns about using the DSM-5. Some of those common concerns are listed here. You can pause the screen and take a look and see if any of these apply to you. The remainder of this presentation that you can look through on the slides that are posted on Blackboard are to talk about beyond the clinical purposes of assessing an individual client so that you can do a really good job treating that client, that there are other reasons to use assessment, and those would be related to epidemiology, which is to identify patterns within different populations related to mental health and mental illness. And this is really important and is part of the reason why we need to do such a good job of thorough assessments, because the assessments can then go into building scientific patterns of tracking mental illness and getting policymakers attention for funding to treat